Sir, my topic is adductor canal anatomy, indications and significance of adductor canal blocks. And it's only a little there. So anatomy, the position of saphenous nerve in adductor canal was first described by Mansworth. Adductor canal is also known as Hunter's canal or subsartorial canal. It is a musculo-eponeurotic narrow conical tunnel located in the thigh, 15 centimeter long, extending from the apex of the femoral triangle to the adductor hiatus of the adductor magnus. Gives passage to the femoral vessels from femoral triangle to the popliteal fossa. The boundaries are anteriorly, that is the roof of the canalis, sartorius medially, and vastus medialis androlaterally. Floor is formed by adductor longus above and adductor magnus below. Medially, it is bound by the aponeurosis, vastoadductor membrane, and it is covered by the sartorius muscle. The content of the canal are femoral artery, femoral vein, saphenous nerve, nerve to vastus medialis, obturator nerve occasionally seen, and subsartorius plexus. In the ultrasound anatomy, sartorius muscle descend in a lateral to medial direction across the anterior thigh, forms the roof in the lower half of the canal, appears as a trapezoid shape beneath the subcutaneous layer of the adipose tissue. Sides of the triangle are formed by vastus medialis laterally and the adductor longus or magnus medially. The saphenous nerve is typically imaged as a small, round, hyperechoic structure anterior to the artery. The femoral vein accompanies the artery and the nerve at the depth of 2 to 3 centimeter. The indications for adductor canal block are usually not performed alone. It is done in saphenous vein harvesting, knee arthroscopy, ACL reconstruction, analgesia for medial meniscectomy, wound exploration, abscess drainage of medial malleoli, usually in conjunction with popliteal sciatic block for lower leg, foot and ankle surgery. High volume block when performed with 20 to 30 ml can be used for total and unicompartmental knee replacement. The significance of the block is it's a purely sensory block, mainly blocks the saphenous nerve, that is the terminal branch of femoral nerve L2 to L4. Technically easy and reliable block for saphenous nerve. It is performed at various levels, above knee, at the knee and below the knee. This technique is above the knee technique at the adductor canal level. Used for daycare procedure analgesia and early ambulation of patient can be done. So it is part of IRAS protocol nowadays. Helps reduce utilization of the systemic therapy such as opioids. The saphenous nerve mainly supplies the medial side of the knee till foot and terminating distally at the ball of the great toe. So any procedures from above the knee till the great toe during along the medial side can be performed with the block of the adductor canal. That's also.
Very good. So, can you do a varicose vein stripping with adductor canal block?
It is given as a sensory block, so it can be varicose harvesting can be done. It is written like that. So I was also having doubt.
Varicose vein usually where do they start the identification?
The junction at the junction of the thigh and
It is above, but below, if you want to do a stripping, you start at the medial malleolus, exposing the saphenous vein, and then introduce the stripper to that, and then try to pull it out, isn't it?
okay.
Have you seen a varicose vein stripping done?
Yes, sir. Yes, sir. But I have not seen in this method, sir. I have seen from above, from
Yeah,
the total.
usually they start at the inguinal, below the inguinal ligament, identify the junction of the saphenous vein to the femoral vein, ligate it, and then they can introduce the stripper from above, or you can do it from below also, and then.
Yes.
But it cannot be used because it is giving analgesia, as you said, only below the knee. So
Yes,
for the thigh portion, you have to either do it in integration at the local, or you have to go for a central neuroactive socket.
okay.
What is the other name for the sartorius muscle? Have they taught you during your anatomy days?
Yes. Honeymoon muscle is.
Honeymoon muscle.
Taylor's muscle.
Tailor's
Yes.
muscle. Why it is
Tailor's
called
muscle.
tailor's muscle? Because in
Tailor's
those
muscle.
days, the tailors used to use the pedal to do
Yes.
the stitching.
Yes,
So
the opening.
it's also called tailor's muscle. Okay.
Okay.
So this is all what you can write for a short question like that. Anyway, just for a visual impact, I'll just share the
That's all.